Welcome to Computational Genome Biology. Today, we are investigating a medical crisis hidden behind the history of the 20th century's most infamous disease. While polio is largely viewed as a historical relic, an estimated 10 to 20 million survivors worldwide are currently navigating the long-term, modern consequences of the infection. Among the general elderly population, yearly fall incidence sits between 17 and 42%. For polio survivors, between 50 and 84% suffer at least one fall every year. In a recent cohort, 74% fell within a single 12-month period. Most of these individuals are classified as recurrent fallers, meaning they suffer multiple accidents that frequently lead to bone fractures and hospitalizations. These survivors face a dangerous medical paradox. Standard fall prevention routines often prioritize aggressive strength training, yet these exercises can overtax denervated muscles operating at their maximum physiological capacity. Pushing these fragile systems too far can trigger mechanical failure rather than building stability. Because generalized geriatric medicine can be counterproductive for this demographic, we must look past typical aging factors to uncover the specific biomechanical reasons these individuals are collapsing. Welcome to the Computational Genomics Biology channel. Today, we are investigating a medical crisis hidden behind the history of one of the 20th century's most infamous diseases. While polio is viewed as a historical relic, an estimated 10 to 20 million survivors worldwide are currently navigating the modern consequences of the infection. This chart highlights a staggering safety disparity. Among the general elderly population, yearly fall incidence sits between 17 and 42%. For polio survivors, between 50 and 84% suffer falls annually. In a recent cohort, 74% fell within a 12-month period. Most of these individuals are classified as recurrent fallers, meaning they suffer multiple accidents that frequently lead to bone fractures and hospitalizations. These survivors face a dangerous medical paradox. Standard fall prevention routines often prioritize aggressive strength training, yet these exercises can overtax denervated muscles that are already operating at their maximum physiological capacity. Pushing these fragile systems too far can trigger mechanical failure rather than building stability. Because generalized geriatric medicine can be counterproductive for this demographic, we must look past typical aging factors to uncover the specific biomechanical reasons these individuals are collapsing. Researchers at the Academic Medical Center in Amsterdam launched a large-scale study to isolate the true risk factors associated with post-polio syndrome falls. The results systematically ruled out the classic drivers of elderly accidents. In this cohort, factors like advancing age, living alone, and polypharmacy, the use of multiple prescription drugs, showed no statistical correlation with fall frequency. Instead, the data isolated a much more specific variable tied to the timing of the accidents. This clock graph shows the timing of the reported falls. Nearly all incidents occurred during the day, with a massive concentration of data points specifically in the afternoon. This afternoon clustering points toward the depletion of finite muscular energy reserves. By late in the day, the constant effort required to move has pushed compromised muscles to their limit, leading to predictable mechanical failure and sudden collapse. The study identified the primary muscular culprit as severe weakness in the knee extensors, specifically the quadriceps. This diagram shows the biomechanical necessity of the quadriceps during the gait cycle. To safely bear the body's full weight during the stance phase, the knee joint must lock rigidly in place as the foot strikes the ground. When quadriceps strength drops below a critical threshold, this locking mechanism fails. The result is a sudden, violent buckling of the knee that drops the survivor to the floor. This failure is worsened by proprioceptive degradation. Damage to the muscle spindles during the original infection alters the survivor's internal sensory map, making it difficult to subconsciously correct a minor imbalance before it becomes a catastrophic fall. These mechanical failures cause profound psychological trauma. Data from the Falls Efficacy Scale showed that 63% of survivors live with a constant fear of falling while performing mundane tasks like showering or walking in their own neighborhood. This fear creates a measurable feedback loop. The concern about future accidents forces many survivors to restrict their daily movement, which accelerates physical deconditioning and progressively increases the risk of instability. Polio survivors are trapped in a compounding crisis. Their joints are mechanically buckling at the same time their psychological fear restricts the movement needed to maintain their remaining strength. Because the mechanics of these falls are unique, prevention requires a customized 4-pillar clinical strategy. Pillar 1 is environmental modification. Over half of all falls occur within the patient's own home, making the aggressive removal of domestic tripping hazards a primary safety requirement. Pillar 2 is fatigue management. Patients must be explicitly taught to pace their activities, strategically conserving their limited energy to avoid the exhaustion that triggers afternoon collapses. Pillar 3 is targeted biomechanical support. This requires a relentless reevaluation of external orthotics to ensure they are providing the necessary resistance to prevent knee buckling in real-world environments. The study highlighted a major gap in this support. 56% of survivors who were prescribed specialized orthopedic shoes were not actually wearing them at the time of their recent accident. Finally, Pillar 4 is psychological intervention. Treating the paralyzing fear of falling as a primary medical pathology is necessary to stop the cycle of activity avoidance and physical decline. Treating these falls as a specific mechanical symptom of post-polio syndrome allows clinicians to move beyond generalized geriatric care. This targeted approach protects the physical integrity and preserves the hard-won independence of a highly vulnerable population. Thanks for watching. Please like and subscribe Computational Genomic Biology YouTube channel.